I want to come back to the brain, and this is an area you're passionate about, you know a lot about as the director of Metabolic Mind. For somebody that feels like right now, for whatever reason, whether it's dementia or mental health, you mentioned both of those before, they want to experiment with ketosis as a tool to help with prevention or even to help reverse that. How do they know how deeply to go into ketosis to get benefits?
Yeah.
Because there's ketosis and there's ketosis. There's
Hmm.
quite a spectrum even within that. So, from
Yeah.
your experience, what level of ketosis do we need to get to before we really start to notice the difference with the brain?
Yeah. It's questions like these where I really, really love my position at Bazooki Group and Metabolic Mind because I get to interact with so many experts on a daily basis, whether they're clinician experts or experts by experience with their own personal experience. And one of the lessons is it varies, right? Now, in general, it looks like most people are going to see the highest brain effects in the 1.5 to 3 millimole range, but that's going to be different for everybody. So actually at Metabolic Mind, we're launching Think Smart, which is going to be a community-based tool basically for people to share their experience so we can learn from the community, right? And someone like Lauren Kennedy West, her ketones are in the 4, 5s, and 6s, and when they come down to 2, she doesn't feel good. She notices her psychiatric symptoms come back. Other people can be, at a 0.5 to 1 and feel great, and have complete resolution of their psychiatric symptoms. So I wish I knew why there was such variation, but it's clear there's variation. But I think on average, we can say probably in that 1.5 to 3 range for brain-based benefits, but don't take that as a hard and fast rule. You got to experiment. You got to do your own experiments. You got to test. You got to see how you feel, and respond appropriately. But I think once we launch this Think Smart program, we're going to learn a lot more. Just, community source it and learn from other people's experience. It's going to be really exciting.
You talked about one specific patient there that when she dropped down from, I think it was 5 or 6 to around the 2
Mhm.
range,
Yeah,
her mental health symptoms would come back on.
right.
Is there a certain period of time that you find, and obviously this can depend on the person and their situation, but that somebody needs to go on a ketogenic diet, create ketones for the brain, fix their metabolism, and then over time can maybe introduce more carbohydrates and be more flexible over time?
Yeah. Yeah, great question. And the answer is yes for some. So other examples, and of course these are personal examples. We're going to learn more through research. But at Metabolic Mind, I have the pleasure of working with Hannah Warren, and she had mentioned to me how in the beginning of her ketogenic journey, she needed higher ketone levels, right, like around 3, to keep her symptoms away. And now she's perfectly fine, at 1 or below, and so that changed over time. There's another gentleman who in the beginning needed to be in strict ketosis and now actually is in ketosis Monday through Friday, and Saturday and Sunday, kind of gets a lot more lax with the family and comes out of ketosis and does just fine and picks it up again on Monday. Now, if he stretches it to, out of ketosis to Monday and Tuesday, he'll start to see symptoms come back. But he's worked it out for him where he knows where his level is. But it wasn't like that in the beginning. So there are examples of that. Is that going to be the same for everybody? No, it's not. There's going to be a lot of personal variety. And look, the research is exploding in this area. And in the next couple of years, we're going to have so much more data because I don't know, I think there are like 15 clinical trials going on right now or about to start enrolling. And so there's going to be a lot more to answer these questions. In the meantime, that's why we want to create a resource like Think Smart, so we can sort of crowdsource the learning and people can learn from each other, as we're getting more of this research evidence come in.
For somebody that's deep in ketosis, they're finding benefit there, say for mental health, but it's been like a year or two, and they're starting to Google online and hear people say, ketosis long term, you can't do that. You start to run into health problems. What's the research showing with that?
Yeah, so we did a video on our Metabolic Mind YouTube channel about this specifically. Well, can I do keto long term? And And basically, anybody who says there's evidence that long-term ketosis is dangerous is simply wrong. There isn't evidence that long-term ketosis is dangerous. Now, there isn't evidence that long-term ketosis is safe because it hasn't been looked at, right? It just simply hasn't been looked at. But anything to suggest it's dangerous is just simply wrong. And a lot of the problem is when you look at the studies, they'll look at, oh, see, this study shows low carb. The people who are low carb have a higher incidence of heart disease or dying prematurely. And they're observational studies, nutritional epidemiology, which are very low quality studies to begin with. But then they define low carb as 40% of your calories from carbohydrates. That's 40% of your calories from carbohydrates, where a keto diet is like 5% usually. So you're talking about, 20 or 30 grams per day versus 200 grams per day. Those are not even in the same ballpark. So to assume one equates to the other is just wrong. But those are the studies most often cited when saying you can't do keto long term. And the other is the heart disease concern. It's going to raise your LDL. It's going to give you heart disease. Not proven whatsoever, right? And so there's no evidence for that. And if you're using it to improve your metabolic health and to improve your brain function and your mental health, like where's the concern there? So no, there's absolutely no evidence that long-term ketosis is dangerous, and the evidence people cite is just doesn't apply really. So so it's something that you just need to follow for yourself. How is your health responding? How is your metabolic health responding? How is your cardiovascular health responding? We can test for these things. We don't have to guess.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Metabolic dysfunction for a lot of doctors, and certainly the way I was trained, is whether or not you have type 2 diabetes. And if you're short of that, you're okay. Metabolic dysfunction, being metabolically unhealthy, starts at that early stage of insulin resistance when your body